Hi, everybody. This is Chanel Wagler. I'll do this, Amanda. We are excited to partner with HHS and the Iowa Child Care Collaborative. We have been through quite a process over the last few months and are excited that we have groundbreaking work happening in the childcare industry to automate and bring to what I want to say this century. And are excited to have the folks today that are in this work and here to share a little bit with you all. And with that, I'm going to go ahead and let you guys begin and share a little bit about what financial management consultants are doing.
Thank you, Chanel. I think Jacqueline's going to get us started off, and I'm going to share my screen as she's doing that. So.
Good morning, and thank you for having us today. We are very excited to share some updates and information about our financial management program.
Yeah.
So I am Jacqueline Penning, and I am one of the 2 financial management supervisors for our Child Care Collaborative of Iowa.
Hello, and I'm Rebecca. I'm the other financial management consultant supervisor.
All right.
So with that, we're just going to kind of just get started on a little bit of review, a little bit about how we got here, a little bit about what we're doing, and have some time for questions and answers because we know that you guys are all busy and doing great things. So we want to be able to be respectful of your time with that. So can everybody can you see my screen, Jacqueline?
Yeah, but it has the notes on it, so I think you need to change the view.
I wondered that because it's flipped over. So let me just flip that over. So sorry, guys.
And don't forget to add the sound.
Yep, I did the sound.
Okay.
I did that part.
We have a short video clip, so we want to make sure you all can hear it.
It just, oh, I'm so sorry. Just going to the other screen when I do that. Well,
Fine. You have a very friendly crowd here today. So.
I know.
No,
but,
no problem.
When the technology doesn't do the way you want to do it.
Oh yeah.
Anyway, okay. Well, we are just going to
Either way is fine.
roll with that.
Yeah.
And let me just try one more time. It just goes to the other screen. So let me, so sorry, you guys. You guys are all like, oh, Rebecca just can't even get it together this morning.
No, I can start talking while you're figuring it out.
That would be great.
Okay, so Child Care Collaborative of Iowa, and there we go. Financial Management Consultants launched in October. So we have been running this program for a little over 3 months now, and we are very excited. We have had an amazing response and turnout to this program across the state. So we kind of figured we would see programs reaching out to us in certain areas, some of the bigger areas like Des Moines and Davenport and Council Bluffs, but we are actually seeing quite a few people reaching out across the state. And so to start off, we wanted to share one of our testimonials of one of the programs that have been working with us. So as business owners, we loved how it would streamline so many things in one place. The added technology component was amazing for us. We were able to get 2 more computers. The monthly fee we were paying for the CCMS is now covered for a while, which gives us some freedom to spend on other items that are needed. And this is from Little Sprouts Daycare in Algona.
Yay. It's fun to be able to be working with these programs and kind of hear what's happening. So here's kind of where the review happens, how we got here, knowing that all of us are here supporting childcare providers and knowing that we were just kind of missing a little piece of the puzzle, which was that business side, that kind of side of the business. So along with the governor's task force, a lot of really great people put their heads together and to see how we could better support our programs in Iowa. Along with that came the partnership between Early Childhood Iowa and HHS and many other folks along the way to make the Child Care Collaborative Iowa happen and be able to launch this this kind of program that is kind of really unique. Like Chanel said, we're kind of groundbreaking. We're the first state in the United States who is doing this or statewide. So it's really exciting to be able to kind of be here with that. So kind of a little bit how we got here. And
all right. So as we know, in this field, educators did not open centers or open their homes to children to be a business. They are learning now that they are truly professionals and they are needing to run it as an actual business. And what we're finding is that when they are taking these trainings, those trainings just truly aren't enough. They need that extra consultation and one-on-one to implement those things they are learning in the training. So that's where us financial management consultants come in. But we're also finding out that only a third of the providers are using technology. So pairing with those CCMS vendors and allowing this technology grant gives them not only the access and the opportunity to start using technology with their program and just further their business and make it a little bit easier because they don't want to be that accountant. They want to be there for the children.
And that's one of the reasons why child care management system has been part of this. I like to refer to it as a bundle package. We're kind of unique in that fashion. So providers also get access to this child care management system. And why we're saying the child care management system is such a nice thing is because it does put all of those things into one spot. So like Jacqueline said, providers are busy. They got into this business to take care of kiddos, to educate and not necessarily do that business side. So if we can kind of come in and help them organize on the child care management system, be able to use it for financial purposes, parent communication, attendance, being able for a spot to keep some of those records and help them get organized, that's what we want. So that's why we're so excited to be able to partner our bundle with the financial management consultants with a child care management system.
So as Rebecca referred to our program as a bundle, when you come and meet with a financial management consultant, sorry, can't talk this morning, you get access to 1 year paid subscription with one of our state identified CCMS vendors. So the state chose Playground and Brightwheel, and so far we are seeing a great response from participants who are working with both of those vendors. They are very willing to work and compromise and find new ideas for their software to work better with programs. They get to work with one of us for a year as well. So they get their, we're calling ourselves their cheerleaders. We are supporting them. We are helping them in any way we can. And then they also get access to up to $1,000 for technology needs. And these top technology needs are linked to what they need for the CCMS. So we are finding a lot of programs are wanting tablets in each of their classrooms so that the teachers can do that parent communication, send those pictures and updates that parents want to see. Some are needing a tablet for that sign in and out at the front of their center or home. And, some programs just don't have a laptop or a desktop. So we are seeing a wide range of needed items, but everyone seems to be very excited to be able to take advantage of this grant.
That's right, they are. We're also really excited because we're not only growing the program with our consultants, but with enrolling homes and centers into our program. So currently we sit at 9 financial management consultants, which is really exciting. When we started this in October, it was just Jacqueline and myself. So we have got some really great financial management consultants on our team. They're getting up and learning and getting out there with providers. Our hope is to still be able to offer, have 4 more spots, and we are currently advertising for those positions. We have approximately 400 programs, childcare programs, who have enrolled in our program, which is, I think, a huge response. We're so excited. We do currently have a wait list, and there are approximately 130 people on that wait list right now. Now, just because they're on the wait list doesn't mean they don't get access to Bright Wheel.
All right, I will keep you posted. Thank you so much.
They can hop on Bright Wheel or Playground right away and start getting that free access to the child care management system. We're just playing a little bit of catch up, and we'll get to those folks really soon, but doesn't mean that they can't sign up and get going. Just means that they're not going to have an active consultant for just a little bit, but we're working through that list. And as you can tell, we've made a pretty good headway on those providers who are signing up. So we're really excited for that portion of it.
Yes, and definitely. And even though they may be on the wait list, they are still able to reach out to me and Rebecca with any questions. So they are still getting any help they need, just not that direct one-on-one consultation. So they are getting help with any simple questions. So as financial management consultants, we are going to be working with those providers. We do not have any requirements except for they need to be registered or licensed with the state of Iowa. So we are offering this program to all home centers and Department of Ed programs. And we want to identify those strategies to strengthen their business and financial sustainability. We are also going to be supporting the programs in what we have learned is the iron triangle is basically the perfect combination to make a well-run center, obviously in a perfect world. So we have a little work to do, but, helping programs know that full enrollment, full fee collection, and knowing your cost per child calculations will help you run a good business and a profitable business. And finally, helping providers implement those business practices that we talked about. So they know all about education and how to support young children, but they may not know those aspects of efficient operations like budgeting or what their tuition rates should be, or even just how to collect those fees so that they are able to pay their staff, keep their center running, and keep the children happy.
And, we're going to work in a variety of ways to kind of do that. Some of that is just through normal consultation, setting goals, asking questions. Where are you at? Some of it is Playground and Bright Wheel are working to build us a little bit of a dashboard to be able to see the usage of the people's childcare management systems, not to see their personal information, not to see dollar amounts or things like that, but to be able to see that they're using that parent communication piece, or that they're using sign in and sign out. So if there's an area that they're not using, we can talk about that, and we can encourage them to maybe try something new with the program. We will also walk through, we have sample templates or budgets or sample policies and procedures that may be helpful to them. We will work with them on that and making sure that they have the best setup for their program on this business side. There's been some questions about, well, Rebecca, you're not a tax expert. You're right. I'm not. I'm not a licensed financial planner by any means, but what we do have is we have that childcare hat on and understand how a childcare business can run. And we're there to support the program in those tax conversations. So if it's something, even just supporting them to go to their tax appointment or ask the right questions or finding those resources, that's where we're at. So yes, we aren't that tax professional, but we are there to support that provider with those conversations and be able to hopefully get them to ask the right questions or find the right folks that can answer their questions for them. So we're excited about that partnership and that piece of what we will be doing.
So, as we've been working for these last 3 months, all of our consultants have been in programs and started their work. We have already seen so many programs, even making little achievements. I have a program that she is, for the first time ever, working on a budget. And so we have a couple more testimonials of how these providers are benefiting from our program. So the first one says, the Child Care Collaborative of Iowa consultants are top notch. Hey, it feels like I finally have the support system every provider has dreamed of having when it comes to the business and financial side of things. And this comes from Bright Minds Childcare in Hinton. And then another one from a home program in Iowa Falls. She says, my parents are still loving the CCMS and appreciate the iPad for checking them in. It's also made my life logging things on the go so much easier. So even just in this short time, we are noticing what the technology is doing, what the software is doing, and just even having those helpful business tips are doing for our programs.
It's really excited to hear those things about what the programs are saying. And one of the things when we started this project, we were like, how are we going to recruit providers? How are we going to get them involved in our program? And so we had all these kind of strategies. And eventually we know we will need to recruit providers. And this is a little bit like what Jacqueline said, registered licensed programs. Still send them our way. They're still able to hop on our website and get the application and fill that out. Somebody who is using a child care management system might be interested in switching, but that they don't have to. They can still keep their program. We unfortunately won't be able to have the technology grant or the consultation for them, but if they want to just have a conversation about, I'm not sure what is best for me, they can still reach out and we would still be willing to talk to them. On that website that you see on the screen, the midsu.org/CCCI, on there's, like I said, you can find the application for a program. You can also find a really cool selection tool for providers to be able to use. So it kind of back to provider choice to be able to say, when I interview both vendors, what do I like? What's most important to me? Is it parent communication? Is it automation of billing? What does that look like? So there is a tool on there as well for programs to be able to use to access. If you guys want to hand it out or let them know, that's fine too. One really exciting thing that is happening kind of this in this week time period is that with this project, they've been able to build something called an API, which is a data communication. I always go like this. To me, it's always like a bridge over my head. I don't know why, but that's how I explain it. And it's a bridge of communication that talks to each playground and Bright Wheel and talks to KinderTrack for child care assistance. So this week they're testing some programs out there. We've heard from a couple of programs who were in the testing sites. So what's so exciting about this is when mom and dad sign into, or the parent guardian sign in the morning, it's going to log that and it's going to be able to talk over to that KinderTrack site to be able to log their child care assistance hours. So providers, program directors, home providers will not have to go back into KinderTrack and do the 15-minute increments to be able to log their times over in KinderTrack. So we're really excited about that and really excited about that launching for all of our providers, especially those centers and homes that have majority of their kiddos who are child care assistants. Huge time saver on that. So really exciting.
All right, so with any program, we always have provider expectations. The main one with the financial management consultant program is that for the first 3 months, they will meet with their consultants on a weekly basis. So at first, a lot of providers were worried about this weekly commitment, but is very flexible and provider driven. So those weekly visits will either be in person, virtual, email, or phone call, whatever is needed for that program. So if they need that virtual or in-person visit every week, great. If they are a little bit more knowledgeable and just need that check-in, we can do a phone call or an email. Once they hit their 4th month, then they switch to a monthly check-in. And again, those are going to be those phone calls, virtual emails, or in person. So it is nice. And we've heard that providers, again, were a little nervous in the beginning, but now are really liking those weekly and monthly check-ins because it's what they need and it's supporting them. So as their expectations go, they will be meeting with us on a regular basis. We are going to be working with them to implement all those aspects of the CCMS. There are so many features on both Bright Wheel and Playground that a lot of programs haven't even delved into yet. So helping them explore those softwares. They're going to share any forms, documents, data, that sort of thing. That way we have the complete picture and we can share with them as well. Just that collaborative process of making sure everyone has all the information to best work with each other. And finally, we're going to work on goals. And again, it's very provider driven. So we aren't going to go in there with a preconceived notion of what they need. We're going to have that discussion. We have an assessment where we go through, do you need policies? Do you need a budget? Do you want to see if it's time for you to raise your rates? So again, just looking at those goals, working on those goals, and just making those either little steps or huge steps to better improve their business. And then again, collaborating with any of those community partners that they may need help with as well. So we are doing great things.
Next, we have a little video and just a precursor. She does talk about what management system she has chosen, but know that this is the same for other both management systems. We just happen to have, this is the only one that actually submitted a video for us. So let's hope that the sound works. Jacqueline, give me a thumbs up if you hear it.
My name is Kelsey Anderson, and I'm the director of Bluff's Little Thinkers here in Sergeant Bluff, Iowa. We learned of the financial opportunity to get a $1,000 grant along with a childcare management software for free for 1 year through our wonderful financial management consultant, Rebecca. She was able to aid us in getting rid of 3 programs that we currently used and getting everything wrapped up into one. We did do our research between both companies, and in the end, we did choose Playground. They had a few perks that we just felt were a better fit for our corporation and what our beliefs, values, and mission statement is here at Bluff's Little Thinkers. We have been able to take everything all digital. We now have our application and all enrollment information put into a PDF fillable document that our parents are able to fill out. The billing, and along with the ability to have live interactions with our parents via personal messages and communication between teachers, has been nothing short of amazing for us. And we have been able to really continue to grow our program, and it's something awesome that all of our families and all of our teachers really do love. One other thing that we really do love about Playground is that anytime we need an answer, we have a customer service issue, or we're struggling with something as we're learning the system, we have an answer within minutes. We all know as childcare providers that we don't have a lot of time, and we're busy, and we don't have a lot of time to sit around and wait for an answer. So that was something that was very important to me, was the response time. I definitely encourage all providers to use your financial management consultants. They are a wealth of knowledge, and that's what they're here for. Overall, the program has been a huge success for us, and along with getting the $1,000 grant, it was very simple, and it is a small time commitment to have such a blessing for your program. Thank you.
So just a little snippet from the provider's mouth about what's happening, how it's working. I mean, 3 systems. I know they were using Remind, they were using another childcare management system, and they were using another system for their time in and time out for their staff. So they were able to decrease 3 different subscriptions that they were paying for into one. So I think it's just huge. So anyway, thanks, Kelsey, for sharing that with us.
My name is Kelsey Anderson.
We could listen to it again.
Yeah.
So with this program, we know that we will see results. And some of the outcomes we are hoping to see with our programs using these two vendors is the big one is save time on administrative tasks. Like Kelsey said, she went from 3 systems down to 1 and is now spending less time on all those paperwork and miscellaneous duties, not directly care with children. They are able to collect fees through automation. And again, they are saving time because they are not asking those parents. It is an automatic email or notification to those parents like, hey, your payment's due, or hey, your payment's overdue. So again, getting fees and saving time. They are going to be able to, we're identifying what policies or procedures they don't have. And some of these policies and procedures are going to link up with what they need for DHS, what they're going to need for IQ4K. So again, that collaboration piece of how we can work together. Through this, they are going to realize the best practices for their business. And finally, hopefully, with saving time means maybe they don't need that extra staff person to enter in all the enrollment information, so they can save money and put that extra money towards staff wages, bonuses, items needed for their program. I found a program and they didn't realize how much they were bringing in until they started actually putting it into the automation system. And she realized, hey, now I don't have to raise rates this year. I can wait till next year. So just those simple little things that they're finding out. And then finally, we want all of our programs to have that financial stability and sustainability. Keeping programs open, keeping teachers in the classroom is ultimately going to benefit the children and the families, and that's what we want.
Yes, that is exactly what we want. We want them to be able to spend time with their kiddos. So kind of the main gist, if you guys have questions, if you guys have programs, send them our way. We would love to be able to talk to them, answer their questions, debunk any myths that they might have been hearing out there about the program or what things look like, and really kind of get them into this trial period. There is no although we will want them to continue with the child care management system, there is no like strings attached that they have to continue using it after their year. So if they absolutely don't want to continue with it, they don't have to. We again want them to. We want them to be able to do that. But there is no real strings attached with it. We just want to be able to strengthen the childcare business. We know that that's such a huge need. So send them our way. We'd love to be able to talk to them and move forward with that. So get in touch with me and Jacqueline. I think we have a few things in the chat, but I haven't been able to look at it. So do we have questions?
No questions so far in the chat.
Okay. What questions does everybody have? Are there things that you want to ask about or talk about, or things that we might not have covered that you're interested in, or anything?
So Rebecca and Jacqueline, do you want to talk a little bit about the baseline survey that you do to kind of try to get started in your work with providers and kind of how that moves forward?
Yeah, so one of the things that we do on our first visit with programs is a baseline survey, like Tammy said. So we're just gathering some information, basic, just kind of seeing what program they're using, have they started to use it, how many functions they're using, do they have a few maybe policies or procedures about certain things. Like one of them would be about, do you have a policy or procedure about looking at your rates every year to raise them? We know that a lot of programs have that maybe built into their enrollment paperwork or things like that, but maybe putting it into policy is really a good way to be able to look at that every year, really dig in and know that that's happening. Also letting parents know that this is something that happens every, July 1st or January 1st type things. Some very simple kinds of things. And then we also have the same survey that we will ask them at the end of our year of consulting with them to kind of see where they're at. Did they implement some of the things? Do we need to change some things? So we're learning and growing and knowing how we can better support those programs just by gathering some of that information.
We do have a couple questions in the chat, so I will address the first one. Christine asked, can you tell us the basic differences between Brightwheel and Playground? So that's a great question, and we get that from a lot of our programs. We are referring them obviously to both programs to reach out and use that selection tool. But what we can tell you is basically both Playground and Brightwheel are very similar. They all have the parent communication. They have staff, parent sections. They're going to have menus, lesson plans. Right now, the only difference that we've truly seen between the two is that Brightwheel outsources their payroll through QuickBooks, whereas Playground is going to be building that into their system. So right now they are very comparable. There's just that one main difference. So again, if you have providers having questions, you know, we can give them those direct contacts for both of them and give them the selection tool so that they can see what's going to best fit their program.
Yes, Tammy wanted me just to pull this up. This is the selection tool that is on the website for programs to kind of be able to look at that. Again, we're that unbiased opinion. We can kind of, like Jacqueline said, kind of tell you a little bit about what each program has, but they're very similar. But here is a way to be able to have providers be able to look at this and be able to have them kind of see what's most important to them and what things look like for them. So you can find this on the website. So print it off, share it. Oh, sorry.
Yeah. So in your looking through the different platforms, have you noticed, are there any like modules for programs around how to do the parent communication effectively? In my experience, I found that centers that are moving toward a technology-based system tend to struggle with how do you get teachers to keep supervising children and not being on the app all the time? And just some additional, just tips and tricks as to how do you, I don't know, encourage that, because I feel like it kind of gets away from some directors at times.
Yeah, Jenny, I think that's huge. And I think that's been a lot of conversation that I've had with my programs on how to make sure that they're not having their heads in the iPad and they're actually doing that kind of piece, you know, the whole time. So I know that both vendors, I know Playground offers a live parent training that you can sign up for, and they actually come in and kind of do some of that pieces. Brightwheel has some on-demand stuff. I can't tell you that I sat through either of them to 100% know exactly what they say, but I think that is all things that will be learning and talking about on ways to make sure that they're not doing that. You know, some programs, it's as easy as, you know, it's that room identified iPad and not logging it on their phone. So, you know, staff's phones are still up. So there's not the Facebook or the Instagram or TikTok or whatever on those iPads that they, you know, so they're not getting distracted. They're doing that. But I do think that is, you know, a concern and something that, you know, we need to make sure that we, you know, that we talk about as you're going out and doing that. So as far as the modules, I know there's some out there, but I just don't know exactly everything they cover.
Another question we got is from Tracy. Is there a one-page flyer that we would be able to share out? And yes, we have a flyer both on the program, as well as we just created one for which consultants are in which area. So we would be happy to share those flyers with all of the regions and anyone that's interested. So we can do that after this meeting if you're interested. And then
also, I just want to say on that too, on the website, there is 2 short videos. I think they're both right around 3 minutes from each vendor, kind of going over what their programs look like individually. Those are landed on our Child Care Collaborative Iowa website as well, along with that selection tool. So it gives a little bit of view of what each program kind of does and what they offer. It's not a flyer, but it's a really kind of a great video to be able to share with programs as well.
And I did share our website link in the chat as well. And Leanne was wondering, how often do we let regions know who is participating in the FMC? So we reached out to all the directors to see what they prefer. And right now we've settled on basically once a month, we will let directors know what programs are participating. That way, either the FMCs can connect with the child care consultants and go on visits with them, or just having that heads up so that they know, like, if we're trying to reach out with them or they need to reach out, just having that connection piece. But if there is anything different, if you want it more often, if you're busy and you need it less often, just reach out to me or Rebecca and let us know what is best for your region, and we are happy to accommodate. And then the next one is, does either program have an area to chart milestones or other educational documentation? Rebecca, would you like to take this one?
Yeah, so I know that is something that has been asked and talked about as far as making sure that kind of that link, that collaboration back with IQ4K here in Iowa. So I do know that there are some spots for that. To be able to, for both programs to be able to put that in. So that's really great. Different ones have different things, but easily enough to say there is a spot for that in there. But both vendors have a little different take of how that goes. But there is a spot for that.
And I'm going to say both programs are very open. We meet with them, each program or each vendor, twice a month. And we give them all the feedback we're hearing. We ask if there are things they can change or update, and they let us know. And then they also give us the updates on their end. Like Brightwheel is going to be hopefully connecting with a curriculum. So if that's something a home or a center doesn't have in the future, that's going to be something that they can look at. And kind of like with Playground, they're going to be working on payroll. So both vendors are very open to making all of these programs succeed. So they are doing as much as they can in their power to adapt and make things the best that they can for these Iowa providers.
Definitely. Great questions, you guys. Anything else?
So this is Tammy, and I just kind of want to remind everybody too, next week on Monday, we have the demo from Playground, and then on Tuesday, a demo from Brightwheel. And those specific questions related to what the software has for as far as capacity like the assessments, milestones. Those are great questions to bring up during those demos for those vendors to actually show you what the capacity of their particular product is.
Definitely, yes.
And I was just going to say, not only do our programs that are participating have our support and the support of each of the vendors, but we are also doing peer-to-peer sessions. So people that are enrolled and working with a consultant, right now we've only done one of each, so we are working on it, but they are able to collaborate. So if they are working with Playground, we have scheduled a group time for anyone that's working with Playground so they can talk to their peers and see what's working best for them, or if they have any tips or tricks that they can share. So we've done Playground, we're doing Brightwheel, and then hopefully this year we will be adding additional information sessions, not only with the CCMS vendors, but with like tax people, retirement people, just those different outside community partners for aspects that obviously we're not experts on, but we want to bring those experts in so that if a program is lacking something, say they don't know the best way to start getting their employees health insurance, we can bring in that insurance person and they can talk about their different options and possibilities to support their employees.
And we just appreciate all of your guys' support and expertise in what you guys are doing, and reach out to us if you guys have questions. This is, like we said, brand new, we're learning, we're growing. So reach out to us if there's things that you feel need to be changed or might be needed to be done better. We are fine with hearing that feedback. We want to be able to be the best that we can be for the providers in Iowa. So we're just excited to collaborate with all of you and, reach out. Don't be shy. So, Chanel, Amanda, Tammy, is there anything else that you guys want to say or?
Hey, this is Julie. I just wanted to thank you guys for going on this journey with us. I think it's been awesome. We're going to see some real systemic changes because of this initiative, and that's what we need. So I really appreciate the presentation this morning.
Thanks, Julie. Yeah.
Thank you.
Awesome. Well, if there aren't any other questions or any other feedback, like I said, thanks for joining us today, hopping on. Check out the website. Share the provider selection tool with programs. Let them know that we're out there, and excited to see you out on the road.
Thanks, everyone.
Thanks a lot.